In law, every adult with capacity has the right to make decisions regarding their healthcare, including the acceptance or rejection of medical treatments. This right is not limited to decisions that others may regard as sensible or rational, even when such a decision may entail serious risks to the patient's health. This video essay will outline the laws relating to medical treatment, including when it is appropriate for a patient to refuse care, and statutory regime relating to withholding of life-sustaining interventions. Moreover, it will explain the role of a health attorney, as well as the implications of an advanced health directive in the pre-hospital environment. Based on Mr. Benson's case, a coherent decision will be made for what actions the paramedics should undertake. According to the Queensland Ambulance Services Clinical Practice Manual, a valid decision to refuse treatment and/or transport must be voluntary, informed, relevant, the patient must have capacity, and advice must be given to the patient prior to non-transportation. As Mr. Benson has refused transportation to hospital, the paramedics were required to complete a VERCA assessment for the validity of his decision. Firstly, the decision must be made voluntarily by the patient, absent of any coercion, manipulation, or undue influence. Paramedics should be mindful that circumstances such as dominant relationships, pain, fatigue, depression, or fear can cause influence. Mr. Benson's decision was assessed by the paramedics to be voluntary and free from undue influence or manipulation. Secondly, the patient must be informed in their decision. The paramedic has a duty to provide the patient with pertinent information regarding the condition or suspected condition, the recommended treatment and the risk versus benefits of this treatment, the consequences if the treatment is not provided, and the alternative options. The attending paramedics informed Mr. Benson that they suspected he was experiencing an acute myocardial infarction, and they explained to him the associated risks, including the risk of sudden cardiac death. Thirdly, the patient's decision to refuse must be relevant to the intended treatment or service to be provided. Mr. Benson refused any form of life-sustaining treatment regardless of his circumstance or condition. As well as verbalising his refusal to being transported, cardiopulmonary resuscitation was listed in Mr. Benson's Advanced Health Directive, making it clear to paramedics that the refusal was relevant to the treatment being recommended and the risks involved. Fourthly, the patient must demonstrate that they have the capacity to make a decision. The Guardianship and Administration Act 2000 defines capacity as the ability of a person to understand the nature and effect of decisions about a matter and be able to communicate the decisions in some way. Mr. Benson was able to demonstrate these qualities, including understanding the consequences of refusing transport and possible life-saving treatment. Furthermore, Mr. Benson was not intoxicated and was able to retain the information and communicate his decision effectively. Lastly, Mr. Benson assured the paramedics he would visit his medical practitioner the following day, meaning that advice and recommendations to promote the comfort and safety of their patient was applied by the attending officers. If the paramedics did breach the AHD and failed to comply with Mr. Benson's wishes, the paramedics' actions are considered to be a form of an assault under common law. Moreover, civil liability may also ensue. Further management by paramedics will include comprehensive documentation in their patient record, including all the relevant details regarding their attendance and assessments of Mr. Benson's health and valid refusal.
An AHD, a formal document in which a person is able to give instructions about a future decision regarding their healthcare. An AHD is effective when an individual is unable to make decisions due to losing capacity. In the pre-hospital setting, in order for an AHD to be followed, it must meet the following criteria. Must be cited by the paramedics, must be in writing, must be an original or certified copy, signed and dated by the patient, medical practitioner and an eligible witness, must be in good quality and not defective, and the AHD's direction must be clear, relevant and consistent with good medical practice and must be consistent with the patient's mindset and wishes prior to them losing capacity. Mr. Benson's daughter Jenny, in her role as health attorney, is authorised to direct medical treatments if Mr. Benson loses capacity. However, these treatments must be in line with the stated or demonstrated wishes of the patient. In this situation, Jenny's actions are in conflict with Mr. Benson's wishes. Consequently, she is not complying with the appropriate healthcare principles or acting appropriately in her role as a health attorney. The health attorney should comply with the principles of healthcare in the Powers of Attorney Act 1998, which state that they must choose the least intrusive method of treatment where possible, ensure any decisions made contribute to the patient's health and well-being, consider the patient's best interest, consider the advice of the patient's doctor and healthcare providers. The patient's views and wishes may be expressed orally, in writing, or in any other way, including by conduct. The healthcare principle does not affect any right the patient has to refuse healthcare. This means Jenny has no authority in this case, as Mr. Benson has capacity and has provided a valid refusal of treatment. Furthermore, his AHD supports his decision. End-of-life decisions are always difficult. The responsibility for choosing to withhold or withdraw life-saving treatment is made by medical professionals in consultation with family members under various common laws and codes across Australia. In general, these laws have two requirements. The medical professionals must provide the necessities of life, and the doctor must have charge of the patient. The doctor only has charge once the patient loses capacity, as is common in these cases. For criminal or civil action to be taken, it must first be shown that any action which could have been taken would not have been futile. Futility is a contentious topic which is generally delegated to the attending medical professional. This authority has only been overridden once in court. However, in Queensland, doctors must obtain authorisation from the patient's AHD or substitute decision maker prior to withholding treatment. Although the actions of the paramedics in leaving Mr. Benson at home are legally defensible, an ethical standpoint of society may be to impose treatment upon him under the basic premise of the preservation of life. Let us assess their actions via the 4 principles of bioethics. Autonomy can only be respected by recognising that Mr. Benson has the right to hold certain views and to make certain choices, regardless of Jenny's opinion and emotional involvement. Under non-maleficence, forcing Mr. Benson to be transported to hospital against his wishes would cause him significant emotional distress. Beneficence implies any act intended to benefit another. This came into form when the attending officers respected Mr. Benson's decision to remain at home and provided him with the relevant advice to promote his comfort and safety. Justice is the link between reasonable distribution of scarce resources amongst all the sectors of society, respect for people's rights and respect for morally acceptable laws. Having already discussed his rights and laws which are morally acceptable, distributive justice in Mr. Benson's case will mean that another member of society who desires treatment can now receive that treatment. The rights of the individual to choose if and how they are treated is thoroughly protected in the Australian legal and medical communities. The right to refuse and the ability to maintain that control even after the loss of capacity is crucial to the maintenance of trust between medical professionals, their patient and their patient's family. As difficult as it may be for Jenny and the attending paramedics, Mr. Benson's decision must be respected and his wishes and directives adhered to, even if that leads to his untimely death.